Now we are examining the trigeminal nerve. Trigeminal nerve, the fifth cranial nerve. It has three branches: the ophthalmic, the maxillary, and mandibular division. Most of the cranial nerves طبعا بيها motor part and sensory part, and sometimes it contains also sympathetic or parasympathetic. The motor part of the trigeminal nerve supply the masseter muscles and the temporalis muscle. The most powerful muscles in the human being say that masseter muscles for mastication. So ask the patient to clench the teeth, clenching the teeth and feeling the bulk of temporalis and masseter muscles. Mouth opening passively and against resistance to elicit the deviation of jaw. The jaw deviate to the weak side, إذن هاي الوay to examining for motor part of the trigeminal nerve. The sensory part examining for pinprick sensation and the distribution of the branches of trigeminal nerve. Pinprick يعني ال superficial sensation اللي هو ال pinprick sensation أو touch sensation أو temperature sensation, and the distribution of branches of trigeminal nerve, and demonstrate if any sensory defect of anion skin distribution. فإذا عندنا any sensory defect you have to mention، خاصة إذا عندنا trigeminal nerve palsy. Then examination of the trigeminal nerve be motor, sensory, be reflexes. We have two reflexes in trigeminal nerve. We have the jaw jerk reflex, and we have the corneal reflex. طبعا the way for examining the corneal reflex by using piece of cotton, and you have to touch the cornea. You have to touch the cornea. فراح عندنا sudden blinking of the eye in response to corneal touching. This is positive, and نقول positive corneal reflex, which is normally or usually. If the patient have cranial nerve lesion or if he has trigeminal nerve palsy, he will have abnormal or loss of corneal reflex. The other is jaw jerk. هو هذا jaw jerk. You have to tap to the jaw, lower jaw. فيصير عندنا movement of the jaw نقول عليه jaw jerk positive. فإذا we have the corneal reflex and we have the jaw jerk reflex. This is the distribution of the trigeminal nerve. This is the ophthalmic, the maxillary, and the mandibular division, supplied by sensation of the face. This is the anatomy of the trigeminal nerve, and these are the branches of the trigeminal nerve. This is ophthalmic, and this is the maxillary, and this is the mandibular division of the trigeminal nerve. We have a problem called trigeminal neuralgia. راح تاخذوها in the future in neurology. It's very important, trigeminal neuralgia. The most important cranial nerve examination مطلوب منكم هو facial nerve, the seventh cranial nerve. Facial nerve is emerged from the pons of the brainstem, controls the muscles of the facial expression. It is almost entirely a motor nerve. It supplies all the muscles of the face and scalp. All the muscles of the face and scalp supplied by facial nerve, especially مثلا orbicularis oculi or orbicularis oris. During examination of the facial nerve, you have to demonstrate for any facial weakness if present, and to decide if the weakness بالfacial nerve, is it upper motor neuron lesion or it is lower motor neuron type. Then if it is lower motor neuron lesion, طبعا lower motor neuron lesion معناتها the upper part or lower part of the face affected. Lower and upper part of the face affected معناتها عند lower motor neuron lesion. Facial weakness, to know if it is bilateral or unilateral. إذا عند lower motor neuron lesion أيضا لازم نعرف إنه هذا bilateral or unilateral. In upper motor neuron lesion, usually the lower part of the face affected. In upper motor neuron lesion, facial weakness. أيضا to know if it is voluntary or emotional facial weakness emotional من يبتسم يبين عند weakness with deviation of the mouth. It supplies the test إذن هو mainly motor لكن be sensory. Supplies the test in the anterior 2/3 of the tongue. Anterior 2/3 of the tongue. إذن part of the examination with the facial nerve you have to examine for the test in the anterior 2/3 of the tongue. The examination of the facial nerve start by facial inspection and facial movement. The steps of examination started by راح نقول للمريض ask the patient to shut his eyes as tightly as he can. نحاول نفتح عينه. This is number one. هاي تحفظوها. Number two, ask the patient to whistle يصوفر. شوف يقدر يصوفر يطلع صوت لو ما يقدر يطلع صوت. إذا عنده facial nerve pulse ما راح يقدر يطلع صوت. قلنا ال facial nerve is very important و very common cranial nerve injury or problem هو ال facial nerve. ذاك نشوفه هواية ما يسمى بالبيلز بالسي viral infection مثلا يصير عنده شرجي احنا نسميه الشرجي. Ask the patient to smile or show me يقول له show me your teeth حتى نشوف إذا عنده deviation بالماوث أو ما عنده deviation بالماوث. إذا number one ask him to shut his eyes as tightly as he can. Then ask the patient to whistle. Then ask the patient to smile or يقول له show me your teeth. And ask the patient to inflate ينفخ his mouth with air and blow out ينفخ بقوة ويسد حلقه وبعدين يطلع الهواء. His cheeks تحاول تضغط انت على يعني الشيكس تطلع الهواء. فاذا ويسد حلقه هو طبعا ينفخ حلقه وانت تحاول تضغط على الشيكس. اذا عنده ويكنس راح يطلع الهواء. اذا ما عنده ويكنس ما يطلع الهواء. Air can be made to escape from mouth more easily on the weak or paralyzed side. Then you have to test for the sense of taste in the anterior 2/3 of the tongue. Test sensation of the taste in the anterior 2/3 of the tongue. The affected side of the face has lost its expression. إذا عنده مثلا left sided أو right sided facial nerve palsy راح نشوف loss of expression. راح نشوف flattening less pronounced بالnasolabial fold. Nasolabial fold is less pronounced flat. The furrow of the brow high wrinkles اللي نشوفها بالجبهة are smoothed out. The eye is more widely open بالaffected side than on the normal side. And when the patient smile the mouth is drawn towards the normal side. من يضحك راح يعوج حلقة مبين. The patient is unable to whistle and food is apt to collect between teeth and gums. So this is the way to examining for the facial nerve. هذا هو الاناتومي of the facial nerve. راح نشوفه ايش قد significant is very important. Supplies all the muscles of the face. وهنا الباروتيد gland نشوفه كلش قريب من الباروتيد. لذلك إذا عندنا باروتيد injury أو باروتيد tumor أو باروتيد surgery مثلا نشوف facial nerve liable to get trauma مثلا or injured during surgery. إذا عندنا مثلا surgery of the parotid. This is the هاي orbicularis oculi orbicularis oris. هاي supplied كلها by the facial nerve. شوف شلون يطلع هذا emerge of the facial nerve. And this is the branching and this is the branches of the facial nerve. And also it supplies the test قلنا بالanterior 2/3 of the tongue. And supplies also the lacrimal gland. Tears عندنا ما يسمى بالcrocodile tears. هاي فد problem يصير دول اللي عندهم facial nerve palsy. during opening of the mouth or during eating يصير عندهم excessive lacrimation يسموه crocodile tears. هاي يصير بالcranial 7th cranial nerve palsy بالfacial palsy بالبلس palsy. شوف هذا patients عنده flattening high flattening of the nasolabial fold. هاي prominent. هذا معناته normal عينه موجودة. هاي أيضا normal. هنا الفرو تكون يعني flat والeye طبعا opened. You cannot close the eye properly. فالeye liable to get irritation and you may have conjunctivitis as well. So he has asymmetry during a smile, asymmetry of the facial muscle. إذن هذا شو عنده هسه عنده right sided facial nerve palsy. أيضا هاي عندها right sided facial nerve palsy. شوف الماوث deviated to the weak side. weak side و flattening of the nasolabial fold. نشوف هنا شلون smoothening of the forehead. طبعا هذول كلهم عندهم lower motor neuron facial nerve palsy. Bell's palsy هاي. Bell's palsy دائما of lower motor neuron. Smoothening flattening of the wrinkles. هنا wrinkles تقول له ارفع حواجبك لي فوق شوفها flattened. Inability to close the eye properly with drooping of the mouth corner. Drooping of the mouth corner with هنا flattening of the nasolabial fold. هاي facial nerve palsy. طبعا هاي left sided facial nerve palsy. شوف شلون flattened mouth deviated eyes open flat wrinkles. معناتها عندها left sided upper motor lower motor neuron lesion of the facial nerve. هاي عندها upper motor neuron lesion. يعني ال upper part of the face is not affected. شوف ال wrinkles طبيعية الeye طبيعية only deviation of the mouth. So this is central facial nerve أو upper motor neuron lesion. Only the lower part of the face is affected. هذا facial nerve هاي during closure of the eye راح يصير عندنا الاي بول ترتفع لي فوق يسموه Bell's phenomena. Bell's phenomena. طبعا surprisingly that Angela Jolie شوف شلون flattened عندها من nasal fold. Angela Jolie got facial nerve palsy. Facial nerve palsy.